Webinar is Baltimore County Department of Health Cancer Programs, Cancer Screening and Breast Cancer Awareness. And our speaker tonight is Nicole Garbarino, who is the program manager of our cancer program in our Bureau of Community Health Services. So lucky to have you tonight. What we're doing tonight is having a slide presentation, which will be recorded so people can watch it later as well, and we'll post that on our YouTube channel. Just remember that this is recorded. If you are on WebEx, you can ask questions. You can use the hand raise button, or you can put a question into the chat. If you are calling in on the phone, that makes it a little more difficult, but we can pause at the end and ask if people have questions and people can speak. Please remember that this is a general webinar. It's being recorded, so we ask that you not ask personal medical questions on the webinar. And I think Nicole will start sharing her slides in a moment. Nicole is not a physician, she's not a clinician, so she also will not be answering medical questions, but we'll be talking about cancer screening and prevention. So thank you so much, everybody, for joining us tonight, and I will let Nicole start.
Hi, everyone. Thank you again for joining. So yes, I'm going to kind of kick us off here. So here is our agenda for tonight. We will start with a brief overview of kind of what cancer is, some relevant data, some important terms to know, and then just some general information on cancer screening guidelines. I will then go into a bit more detail about prostate, cervical, and lung cancer screening. And then because October is Breast Cancer Awareness Month, and I know we're at the very end of the month, but we are going to spend a little bit more time on breast cancer screening. And then finally, I'm going to talk about our program here at the Health Department and who we serve and how to access our services. So what is cancer? Cancer is a really broad category and it includes many different diseases with different causes. But the thing that all cancers share is that cells are growing and dividing uncontrollably. Cancer can start almost anywhere in the body, and when cancer spreads from where it formed to other parts of the body, we call this metastasis. And it can help to think of cancer in two different categories. So we have solid tumor cancers and blood cancers. And solid tumor cancers are cancers that start in organs, glands, or bone, such as breast, cervical, colon, lung, pancreatic, and brain cancers. While blood cancers affect the way that your blood cells work and produce. And most blood cancers start in your bone marrow. So blood cancers would be things like leukemia, lymphoma, or myeloma. This presentation is really going to focus on solid tumor cancers and even more specifically, the ones for which there are standard screening recommendations. So the numbers that you see here, these are not actual cases or deaths. These are estimates from the American Cancer Society of what they expect that we will see in 2025 for the number of new cases and the number of new deaths, or the number of deaths for different cancer types. And if you wanted to see additional kind of cancer types from what I have here, you can find this report on their website. There's a lot of interesting information there. But I do just want to point out that what you can see is that we anticipate in 2025 there are going to be the most new cases of prostate and breast cancer, but there are more estimated deaths from lung and colorectal cancer. And in Maryland, cancer is the second leading cause of death. So a couple of terms I just want to clarify before we get started, I think are helpful to know. The first is screening versus diagnostic testing. And screening is something that people do to detect cancers when they are not experiencing any signs or symptoms of cancer. And when people do have signs or symptoms of cancer, that's when they might undergo something that's called diagnostic testing. And this testing is intended to find the problem and to make a diagnosis. And these terms are important to keep in mind when we talk about screening guidelines, because when we're talking about screening, we're talking about guidelines for people who are not experiencing signs or symptoms of cancer. So when we talk about cancer prevention, we also talk a lot about risk. And there are many different factors that can impact your cancer risk. One of these is personal history, so history of a previous cancer, history of cancer treatments, or even a personal history of other conditions. Family history of cancer can also impact risk, and this includes how many family members have had different types of cancer, how they're related to you, and then that specific type of cancer that they had. We then, of course, also have genetic mutations such as the BRCA1 or BRCA2 genes. Um, and what makes people high risk for one type of cancer is not always what makes them high risk for a different type of cancer. So someone could be considered high risk for breast cancer, but they're average risk for colorectal cancer, or vice versa. So this is why it's really important to talk to your healthcare provider to try and figure out if you are considered high risk for any cancers, and if so, which cancers they are. So why do we care so much about screening for cancers? Screening for cancer allows us to identify cancer early, in some cases when it is precancerous and before you may have even noticed signs or symptoms. Screening can also help us to find cancer early on before it has spread or metastasized, which means that treatment is more likely to be successful. And the National Cancer Institute estimates that screening and prevention efforts together saved 4.75 million lives between 1975 and 2020. And this includes prevention efforts such as tobacco cessation or HPV vaccination. So it's not just screening alone, but this is pretty significant. So what I have here are very general, simplified screening guidelines. There is a lot more nuance to who should be screened when, again, based on your risk level. And it's so important that everyone speaks to their healthcare provider about what is right for them and when they should start with these different types of screenings. There are a few different agencies that create screening guidelines, and there are sometimes some small differences in those recommendations. These organizations typically include the American Cancer Society, the United States Preventive Services Task Force, the National Comprehensive Cancer Network, and then for cervical cancer screening, that also includes the American College of Obstetricians and Gynecologists. And these recommendations are typically available on the organization's websites if you wanted to kind of read a little bit more about them. And then also just a reminder that these are screening guidelines and not diagnostics. So if you have signs or symptoms, you shouldn't just be following, these age limits. You should be talking to your healthcare provider. So for average risk individuals, colorectal cancer screening is recommended to start at age 45, and that can include colonoscopy or stool-based testing, but high-risk individuals may need to start earlier than this. For prostate cancer, for most people, the American Cancer Society recommends discussing prostate cancer screening with their provider starting at the age of 50. For those who are of increased risk, it is recommended that these conversations start happening at the age of 40 or 45, depending on what that risk level is. So for example, Black and African American men are recommended to have those conversations starting at the age of 45 because they are considered to be at higher risk of prostate cancer. Breast cancer screening is generally recommended to start at age 40. Again, for some people, based on their risk, it might start earlier than that, as early as 30. And then cervical cancer screening starts at 21 and continues until 65. After 65, prior screening history and results will determine if someone needs to continue on with cervical cancer screening. And then lung cancer screening is recommended for current or former smokers with a significant smoking history who are 50 to 80 years old. There's something on here called, it says 20 plus pack years, and that's basically a formula that people use to figure out how much someone has smoked. Really, it can be quite complicated and confusing to work through. So a really good rule of thumb is if you are a current or former smoker, you're between the ages of 50 and 80, have a conversation with your healthcare provider and have them help you figure out if you meet that criteria. So how do you reduce your cancer risk? Well, it's a little bit complicated because, again, different types of cancers have different risk factors, but these are some really good general tips to reduce your risk. So first and foremost, stay on top of your screenings, get them on time, and have just generally regular checkups with your providers. They will help you figure out what your risk level is. They'll help you stay on track for all of those screenings, and they will help you to identify signs or symptoms that are of concern early on. Because sometimes you might not even think of something as a concern, and when you talk to your provider about it, it flags for them. And then also make sure when you're talking to your healthcare provider, you're being really honest with them about any changes to your own medical history, or if you learn about changes in your family's medical status or history as well. Avoid tobacco products, exercise, and stay physically active. Eat healthy, so try and include whole grains, vegetables, fruits, and legumes, and avoid as much as you can processed foods and red meat. Um, Limiting your alcohol is a very good way of reducing your cancer risk. Less than a drink a day can actually increase your risk of developing certain cancers. Protect your skin from the sun with wearing sunscreen and physical barriers such as hats or sleeves. And get educated. Make sure you understand your own medical history. And if you can, if you have the opportunity to learn about your family's history, do so because that is really important. Um, so now I'm going to go into specific screening tests. These are not comprehensive, but they are going to be the most common screening tests by diagnostic group. So we'll start with colorectal cancer screening. And so colorectal cancer screening prevents colorectal cancer by finding and removing non-cancerous growths, which we call polyps, before they become cancer. And most people are going to be screened either with a colonoscopy or a stool-based test. And colonoscopies are more involved than stool-based tests, but they are better at finding those growths, those polyps. And when you have a colonoscopy, oftentimes those polyps can be removed during the colonoscopy. So colonoscopies really are still considered kind of the gold standard for colorectal cancer screening. But stool-based tests they're much easier. They can be done from the comfort of your own home. The only thing to note is that if a stool-based test comes back positive, you are probably going to need to have a colonoscopy after it. There are some other methods of colorectal cancer screening, but these really are what most people end up having. So a colonoscopy is a way for a doctor to look at the inside of the colon and the rectum using a long, flexible tube with a light and a camera. And a colonoscopy requires preparation beforehand, which I'm sure most people have heard about, the bowel prep that goes with that. But depending on someone's specific medical history, before you have a colonoscopy, you may have to get some additional medical clearances, such as one from a cardiologist or some lab work done. And then depending on the number and type of polyps that are removed, if any are removed during a colonoscopy, that's how the doctor will figure out when you have to have your next one. And that typically ranges from 1 year to 10 years. Stool-based tests are, I think, growing in popularity. I'm sure people have heard about Cologuard and seen all of the ads that are all over the TV and social media. And stool-based tests are approved by the FDA for people who are of average risk and do not have symptoms. So if you are of increased risk of colorectal cancer, this is not going to be for you. And if you have any symptoms, again, this is not for you. You will end up needing a colonoscopy. But stool-based tests they're easy, they're convenient. They do require typically to happen a little bit more frequently than a colonoscopy, depending on the type. And there is still that risk that even after you do this, you're going to have a colonoscopy. So next, we're going to talk about prostate cancer screening. So the primary prostate cancer screening is a blood test, and this is a blood test that measures the amount of something called prostate-specific antigen, or PSA, in the blood. And PSA is a protein that's produced by tissue in the prostate. And higher levels of PSA may be indicative of prostate cancer, but there can be other causes. So before having a PSA test, the American Cancer Society will recommend that you talk to your provider about that test and, risks, benefits, all of that. And some providers may also conduct a digital rectal exam, but this should not be used as the only method of prostate cancer screening. So now we're going to talk about cervical cancer screening. And human papillomavirus infection is the biggest risk factor for developing cervical cancer. And tests can be done to detect the high risk types of HPV that are most likely to cause cervical cancer cells. And then a pap test, which is also a pap smear, is a procedure in which cells are collected from the cervix so they can be examined closely in a lab. And it looks for changes in cells that could indicate precancer. Um, when HPV and pap testing are done together, we call it a co-test. And based on the results of HPV and pap testing, additional tests may be recommended. And then one thing that's a little bit new, it's new for our program, is that HPV testing can, this is again for people who are of average risk, it can be done via self-collection in the medical setting for people who may not be comfortable having a pelvic exam and a provider do this for them. So next we're going to talk about lung cancer screening. And the first step in lung cancer screening is that visit with a provider in which the risks and benefits of low-dose CT scans are discussed and eligibility for screening is determined. The next step would be a low-dose CT scan after that visit, as long as it's determined to be appropriate. And low-dose CT scans can help to find abnormal areas in the lungs that may be cancer. So unlike chest x-rays, research has shown that having an annual low-dose CT scan to screen people who are at higher risk of lung cancer can save lives. And so the way it works for a low-dose CT scan is you would lie on a table, it slides back and forth inside the hole in the middle of the CT scanner, which you can see in this photo is a large donut-shaped machine. And as the table moves into the opening, an X-ray tube rotates inside of it and kind of sends out X-ray beams, which are detected on the other side of the scanner, and it creates a really detailed image of your lungs. Now we'll go a bit deeper into breast cancer screening, again, since October is Breast Cancer Awareness Month. So these are the kind of typical ways that people are screened for breast cancer. Again, there are other things that can be done, but first, a clinical breast exam. So this is an examination by a provider, and this is done manually, so using their hands to feel the breast and try and identify lumps or other changes that way. Mammograms are the most common screening test for breast cancer, and they are essentially X-ray pictures of the breast that can help to find early signs of breast cancer, often before they can actually be felt. So mammograms can pick up on things that clinical breast exam cannot. During a mammogram, you will stand in front of the machine, and a technologist will place your breast on a plastic plate, while another plate presses it firmly from above. And this basically kind of flattens the breast and holds it so that the X-ray picture can be taken. So after a screening mammogram is done, sometimes people will need to have a diagnostic mammogram. Maybe if they have dense breast tissue or there was something suspicious on that screening mammogram. And this can provide more detailed imaging and help to evaluate anything abnormal on that initial mammogram. Ultrasounds can also be used as an additional screening test. And then magnetic resonance imaging, or MRI, can be used for those who are at high risk of breast cancer. So, for example, people with a BRCA1 or BRCA2 gene. And typically that would start at age 30 for people who are at high risk. It would be a mammogram with an MRI. So this is just some general screening recommendations for breast cancer. I will note there is some variation between agencies on some of kind of the nuances of the screening, but these are what the American Cancer Society recommends. So generally, screening will start at the age of 40 with an annual mammogram. Depending on the guidelines, after age 55, you may consider switching to every other year. But again, for those who are considered at high risk of developing breast cancer, an MRI is recommended along with the mammogram, and usually starting at age 30. And just again, a reminder that if you aren't sure of your risk category and when you should start screening, always have that conversation with your healthcare provider and start having that conversation early, because screening can start early for certain groups. This is not a comprehensive list, but these are some risk factors for breast cancer. These include being physically inactive, being overweight or obese, and again, drinking alcohol. risk of developing breast cancer does increase with age, and most cases of breast cancer are diagnosed after 50. Certain genetic mutations and other genetic factors can impact risk, as can family cancer history, even without a genetic mutation. So, starting menstrual periods between the ages of 12 and menopause after 55 also can increase risk because there's a longer period of exposure to hormones. Other risk factors include a first pregnancy after the age of 30, not breastfeeding, or never having a full term pregnancy. And personal history of breast cancer or non-cancerous breast diseases can also impact risk, as can previous treatment using radiation therapy, especially to the chest area. Here are some signs and symptoms that could be indicative of breast cancer. They are not always, of course, but these are just things where if you notice them, you should talk to your healthcare provider right away. So any lumps or masses in your breast or your armpit, swelling or thickening for any part of your breast, even if you don't feel a lump, skin dimpling or irritation, breast or nipple pain, if your nipple begins to turn inwards, which is called retraction, if the nipples or breast skin become red, dry, scaly, flaky, or thickens, any nipple discharge, changes in the size or shape of the breast, and these are, again, this is a pretty comprehensive list, but not always indicative of breast cancer, really a good flag for you to talk to your provider. Here are some things that you can change to reduce your risk of breast cancer. These really do, in many ways, mirror that list I showed earlier that talks about general ways of lowering your cancer risk. But it is really important here to have conversations with your provider, because if you are, especially if you are at quite high risk, there are some kind of special things that you can do to lower your risk of developing breast cancer. But just, generally trying to live a healthy lifestyle, staying active, eating a balanced diet, and trying to get to and stay at a healthy weight. So how do you get screened for breast cancer? So most health insurance plans are required to cover screening mammograms for women over 40, and many plans no longer require an order from a provider, which means that you don't always have to have a clinical breast exam before you go for your mammogram. So this means that in many circumstances, you will actually be able to schedule your own screening mammogram without that provider order. You can confirm this with your health insurance, and the radiology facility may also be able to help you confirm that when you call. Your insurance will also be able to confirm which radiology facilities are in network, but the link here does link to the FDA website where they have a list of mammography facilities on their website. And you can also always work with your healthcare provider to facilitate this screening. And then for folks who are not insured, I will talk more about our program shortly. So this is our program, Baltimore County Department of Health Cancer Program. We are funded by the Maryland Department of Health to provide no-cost cancer screenings, and there are other jurisdictions throughout the state that are also funded, as well as a couple of hospitals who are funded for various screening types. So we are not the only game in town, but we are the one in Baltimore County. And these are the eligibility criteria for our program. I show these, but if you are ever kind of wondering if you might meet criteria, you aren't sure, you just kind of need some help figuring it all out, you can always give our program a call and we will help you kind of navigate it. We are able to serve the entire state of Maryland for breast and cervical cancer screening, although it may, be better for folks to, especially if they live in a faraway part of the state, for us to help them find a local provider. But for lung and colon cancer screening, we serve Baltimore City, Baltimore County, Anne Arundel, Howard, and Harford counties. And again, you can always call us and we can help kind of figure that out and find the most convenient location for you. So typically people who are enrolled in our program are uninsured or underinsured, meaning they still have maybe a large copay, or their insurance for some reason doesn't cover the cancer screening that they need. We can still provide navigation services to people who do have insurance coverage. they just would otherwise need to meet our program's criteria and face certain barriers to screening. So those typically would be things like language or transportation. We do have income guidelines, which are based on income and household size. And then we do have some kind of restrictions around age. For breast cancer screening, our program can only pay for this for people who are over the age of 40. However, if we have folks who are at high risk and need to start screening earlier, we can help them apply for a program through the state called the State Diagnosis and Treatment Program. These are some of the services that we offer through our partnerships with contracted providers in Baltimore County. These really are the screening services that we talked about earlier for breast, cervical, colorectal, and lung cancer screenings. And we can also, there are sometimes additional services we can pay for in the process of getting a diagnosis. And so in addition to providing those screening services, we provide case management and navigation. So when someone starts in our program, we have a pretty thorough intake process through which we determine eligibility, barriers to screening, things like that. And then clients complete our consent paperwork. Our case managers will help to identify all of those barriers and kind of the needs of the client so that we can make sure we can meet those throughout the process. And our team will schedule appointments for anyone who's enrolled in our program. And then our nurse case managers help them to understand the results of their screening tests and anything that they need to do kind of in addition to that initial screening. We also provide reminders for people for when they're due for future screenings. So anyone who is interested in being screened for eligibility can give us a call. Our phone number is really easy to remember. It's 410-887-3456. And again, that's for breast, cervical, colon, and lung cancer screenings. And then I do have the fax number here, which is more sometimes providers will fax us referrals for folks who they think might be eligible for our services. And then I have some general resources just if you wanted to learn more about cancer screening recommendations and what it all means. So the American Cancer Society has a lot of great resources that are really easy to understand and really helpful. The National Comprehensive Cancer Network for a lot of different types of screening. They have patient guides. And then the CDC also has some information on screening. And so now we have some time for questions, if we have any.
Thank you. That was a great presentation. Lots of information. Does anybody have any questions they want to ask? We can pause and just let you speak up, or if you want to raise your hand or put something in the chat, we can try to answer your question right here and now. Okay, there's a question. Is there a waiting list for services?
No, we currently do not have a waiting list for services. That is, something that could potentially change in the future, but right now we do not. And if we ever did, we would be communicating that to folks up front so they knew what to expect.
And I had a question for the group. You talked about lung cancer screening. What if somebody is at higher risk for lung cancer and they're a smoker? Do we have services to help people quit smoking to reduce their risk?
We absolutely do. We have a tobacco program. So if anyone is looking to quit smoking, we are able to provide individual and group tobacco cessations. So that could be smoking, vaping, any kind of tobacco nicotine product. And that's available over the phone, in person, virtually. So they're quite flexible. And I think all of that information is on our website if anyone needs it. But yes, we try and help people both get screened and quit smoking.
Right. And we also have reproductive health clinics where people can get uh, screening for sexually transmitted infections and pap tests as well. So that's a common health department uh, uh, clinic that we have for people in the county who want to get that kind of screening. And I am pausing to see if there's any other questions. Don't see any in the chat. I'm going to wait one more second. So I don't see any other questions now. If people have questions, what is the best way to ask questions after this? One would
Um,
be, sorry.
Oh, yeah. If anyone has questions, they have questions about our program, about referring people, about screening, any of that, if they give us a call at that main cancer number, the 410-887-3456, that's the best way they can get in touch with me. They can, if they're looking for services, have speak to somebody who can assess their eligibility. So that's, I think, the best way for anyone to follow up with us after.
Thank you. And then we'll have this recording of this session on our YouTube channel, our Baltimore County Department of Health YouTube channel. So if anyone wants to go back and check in on any of the information or get more detail or whatever, it will be there probably later this week. So we thank you, Nicole, for the excellent presentation, and thank people for joining us tonight. And please spread the word that we, about once a month, have these webinars with all sorts of different topics related to public health. Oh, and another note that will be on our Facebook page tomorrow, so you can access it through our Baltimore County Department of Health and Human Services Facebook page. So excellent.
Thanks, everyone.
Thank you so much. Hope everyone has a nice evening and hope to see you next month.
Thank you.